Hi, I am Francisco Salvador. It's a pleasure to be here. I am internist and infectious disease specialist in Antofagasta, Chile. Also serving an advisor to the Health Ministry of Chile on diabetes food. Let's talk about the classification, clinical classification of infectious in breve definition. This is a disclosure. I don't have a conflict of interest. According to recent studies worldwide, a person lives due to diabetic-related complication every 20 seconds. Approximately 70% have diabetic foot neuropathic or are neuroischemic. This neuropathy cause minor trauma and in deep tissue infection before pain is perceived. In 2020, the Infectious Disease Society of America, EIDSA, reclassified diabetic foot infections. According to the 2012 IDSI classification, the important thing was the clinical sign of infection until reaching the systemic response, which was grade 4, considered severe to the systemic response. Excuse me, my English is such a systemic inflammatory response syndrome. The metabolic alteration characterizes to hyper and or hypoglycemia. In 2020, the American Society of Infectious Disease reclassified diabetic foot infection according to evolution. If osteomyelitis was included as the element to change the prognostic of lesion. Grade 3, not include bone. Grade 4, any bone infection of the foot. This is important. Grade 1, diabetic foot ulceration without any manifestation of infection, no infection. In infection, grade 2, mild soft tissue infection. The infection is limited to skin or superficial subcutaneous tissues without local complication or systemic illness, rather than to manifestation of local swelling or induration, erythema, any extent less than 2 centimeters around the ulceration, local tenders or pain, local wound, or purulent discharge. Moderate, severe, soft tissue infection, this grade 3, either systematic, stable, or unstable patient with the following erythema extend 2 centimeters for the ulceration, lymphangitis, spread beneath fascia, deep tissue abscess, gangrene, can involve muscle, tendon, and joint, but not involve bone. This includes pacients who meet criteria for moderate and moderate severe infection. Temperature rather than 38 grade Celsius or less than 36 heart rate rather than 18 beat per minute, respiratory rate rather than 20 breaths per minute, or PCO less to 62. White blood cell count rather than 1200 or less 400 cells for microliter, or rather than 10% immature form. Grade 4 or stimulated, moderate or severe foot, any bone infection of the foot, any bone infection of the foot. This includes a patient with meet criteria for moderate or severe infection, as not about include systemic sign. This table shows how to grade 3 compromise bone has a rather use of antibiotic, longer hospital stay, and a higher risk of amputation, a greater number of surgery, and a longer evolution time that a grade 4 with only compromised soft tissues. To diagnostic and monitor osteomyelitis, we rely on laboratory tests such as C-reactive protein and erythrocyte sedimentation rate. Evolution, the sedimental rate in patient osteomyelitis and wound healing in this. And evolution the C-reactive protein level in patient in remission in osteomyelitis and wound healing. Bone culture will not only certify the diagnostic, but will also guide us and the specific treatment of the infectious agent involved. Whatever, as we see here, that is great dispersion of agent that make effective empirical treating difficult. Reason why many times medical treatment fail. The matrix of the offer. Doctor, ¿me puede apoyar en esto, por favor?
This is the biofilm, the matrix of the biofilm formation in the lesion in the skin. are studied by under electron microscopy, and we can see the microorganism and the matrix of the biofilm.
Lo que quiero decir es que esto le permite sobrevivir a condiciones adversas
Yeah. In not good situations, this microorganism can be live by this reason, by the matrix of the biofilm that it's promoved.
In this layer, the microorganism is the biofilm and constitute the predominant phenotype and almost all bacterial in this natural habitat, whether pathogenic or environmental. The biofilm offer the bulwark against environmental stressor and can include organisms from several kingdoms, as in this case of bacterial, fungal, jet specifically, and mixes biofilm. In this slide, a cortical intactness is observed, but this is gas in the subcutaneous cell. Proof the many osteomyelitis are sustained of any anaerobies. Only 3 weeks later, bone destruction is observed, despite the fact that the ulcer has already healed. O sea, 3 semanas después de que de la radiografía anterior,
3
se
weeks
observa
after the last X-ray, the bone has this affection, but can you present the next one, please? ¿Puedes presentar la siguiente?
That is we must change the concept that osteomyelitis is synonymous with amputation. Sin an adequate treatment can cure more than 80% for cases. In this slide, I show a review article that I found interesting on the diagnostic is of osteomyelitis by imaging. This review in more than 1800 article review to
Sorry, doctor, please let us know in Spanish and we will be able to translate.
Lo que importa en esto es que son 18.000 artículos, de los cuales terminamos en 69 para hacer esta revisión del metaanálisis.
Professor Salvador said that start 18,386 articles that to make the review, and only 81 articles arrived to the end, and 69 were reviewed to the meta-analysis. Please, the next one.
several articles were from osteomyelitis in diabetic foot. This, and this.
Mhm.
Hay diferencias. Here are different of from the diagnosis of osteomyelitis in the other scenarios. Again, diabetic foot osteomyelitis.
There are several. There are several manners to make the diagnosis of osteomyelitis, and Professor Salvador showed in this slide some of these tools to make it. MRI, PET, or SPECT, or X-ray. And here in the slide, you can see with the colors, the reference with the tools that make it the sensitivity of the change and the specificity of the change of osteomyelitis diagnosis.
En esta vemos cómo se concentra en un buen porcentaje de sensibilidad y especificidad, pero en la diabetic foot ulcer, this specificity tiene una gran dispersión.
Instead of in diabetic ulcer, the same studies with the same tools have a very high dispersion.
In these slides, show different between in the specific and sensitivity of different techniques. What will make us reflect on the dependence of method, such as CT, SPEC, CT, and magnetic resonance versus or clinical diagnostic. In great usefulness, maybe in diferenciar osteomyelitis from Charcot neuroarthropathy in a patient without an ulcer. How will Hurley be admitted to the world from a bone biopsy and culture?
Mm-hmm.
In this slide, I show you a combined techniques with uses available leukocyte, which would be very useful to different with certeramente osteomyelitis from neuroarthropathy Charcot. Where you can see how a patient with Charcot neuroarthropathy, the great uptake is seen in bone that had osteomyelitis. Este paciente tiene artropatía de Charcot en los dos pies, pero solo uno tiene osteomyelitis.
Say in this patient, the patient have Charcot neuroarthropathy in both in the feet, but only in the left feet have, or in the left part of the screen, you can see the osteomyelitis in this patient.
In this table show how the specificity and positive predictive value reached 70%, and unfortunately desafortunadamente no es una técnica que esté disponible en todas partes.
Unfortunately, this kind of technique is not possible to use in all of the countries. It's a very sophisticated and modern technique, but the specificity is so high.
More centers have magnetic resonance imaging and some with SPECT-CT. One of the advantages of resonance is the possibility of evaluating to soft tissue and fistulous tracts very well. In this case. Finally, in this table, you can see the value of specificity and sensitivity and predictive value, both negative and positive, showing that we currently do not have certainly the diagnostic width of clinic.
Yeah.
¿Se entendió?
Yeah, single photon emission computed tomography have a high sensitivity and a low specificity. But if we compare with the MRI, magnetic resonance imaging, they are in this very similar. There are not so far difference between these two methods. Thank you.
Probe to bone test. The bone contact test or probe to bone has similar sensitivity and specificity to MRI and SPECT-CT, and is immediately and not additional cost to the patients.
Right.
In this proposal, adapted from the article of the Dr. Lázaro Martínez, which combined to the clinical science with the radiological imaging and the probe to bone. Y en esto tienen las recomendaciones si se trata o no se trata con antibióticos de acuerdo a los hallazgos.
So we have the recommendations of the treatment with antibiotics or not, if we can show the alterations in the microorganisms that are in the bone that they make it a biopsy.
Conclusion, the new ASI 2020 guidelines show the importance of osteomyelitis in diabetic foot infection. The diagnosis of osteomyelitis despite technological advances continue to be mainly clinical, where knowledge of the pathology play a predominant role. No sé cómo se pronuncia, juicios.
The judicious use of available resources will allow an adequate diagnosis to be made, avoiding any unnecessary expenses for the patient and the health system. In classical radiology, in a style test can be useful for diagnosis, approaching a high percentage of specificity and sensitivity at low cost. It's true, really it's true. That is a good conclusion about what we will be able to do if we have not the very sophisticated tools near us when we are treating this kind of patient. Yes?
Thank you for this opportunity, and
No,
thank you for
thank you for you, Professor Francisco Salvador, for your very hard effort to share with us your very high experience in infectious. And sometimes knowledge are a barrier to share the knowledge, but not in this case, because we are sharing your experience. Thank you very much.